Hi, Michael James here, and as a former sciatica sufferer, I was willing to use anything that would reduce my level of pain. One striking point that I found in my research was that the traditional medical community did not have all the answers. I found that there were numerous alternative therapies available. I kept an open mind when approaching these non-traditional medical approaches and found that several of them made perfect sense. In this video, I'm going to briefly cover the ancient art of acupuncture and yoga, using key supplements, as well as chiropractic treatments. Modern Western medicine is finally accepting the medical fact that the body is a self-healing mechanism. Given the proper nutrients and mental conditions, doctors have seen patients improve their health condition beyond what they would have expected. Some doctors are accepting the fact that there are disciplines that were created eons ago and referred to as Eastern medicine. Some of the origins of these practices go back 5,000 years and are still more effective than the traditional medication cures employed by many healthcare professionals. A perfect example is prescription painkillers. While these drugs are powerful, they just cover up the cause of the pain versus treating the root cause of the problem. Muscle relaxants will temporarily release the tension in our muscles, but they don't treat the reason the muscles are tense in the first place. There are alternative methods that will provide a better end result. I'm a perfect example of this. After several back-to-back bouts of sciatica, I desperately wanted to put an end to the constant pain. My son and daughter urged me to use acupuncture as a solution to my problem. My results were dramatic. After just a few treatments, my pain level subsided to a bearable level, and then with additional or a few other strategies, I was able to eliminate pain altogether. Acupuncture as a medical practice began over 50 decades ago. If you go to a physician in China or Japan, it is considered the primary treatment method employed to obtain results for their patients. In the West, acupuncture is considered an alternative treatment method. Most physicians are now recognizing the value of acupuncture, and a majority of health plans now make allowances for acupuncture. In brief, acupuncture employs tiny needles that are inserted into various parts of the body called meridians. These needles elicit a response in our body that creates an ideal healing environment, and in the case of sciatica, it reduces the level of pain in a majority of patients. Recently, numerous studies have validated the effectiveness of acupuncture in the treatment of sciatica. Another ancient art that has merit is the practice of yoga. Yoga is a whole-body practice that strengthens and creates more flexibility in the human body while reducing the stress levels that create the tensions that negatively impact the condition of sciatica. Once I mastered about 10 basic yoga postures and employed them in my daily exercise routine, my pain level was reduced even further. The basic premise of Eastern medicine is that the body is a self-healing machine. Like any machine, it has to have proper fuel to operate at peak efficiency. There are a few basic supplements that are critical to this function. I found that when my physician ordered blood tests, that I had very low levels of those important elements. Vitamin D deficiency in a recent study of patients with lower back pain was present in 93% of the study group. Vitamin B12 has been shown to lower the level of pain and frequency of chronic back pain. This in turn can reduce the dependency of patients on NSAID anti-inflammatory drugs. Magnesium supplementation is critical to proper muscle function. One other alternative treatment is chiropractic therapy. The end goal of chiropractic therapy is proper alignment of your spine. An improperly aligned spine can cause sublimations, which will irritate the nerves of the spinal cord and lead to health problems. If you don't want the neck adjustments that is common practice with many chiropractors, you can seek a chiropractor that uses an adjustment tool that eliminates that practice. My acupuncturist made this recommendation, and I have been very pleased with the results. When your spine is in proper alignment, it reduces the inflammation, and that will reduce your pain level. These are just a few of the dozen alternative treatments available to your journey toward a pain-free life. I cover them in great detail in my ebook, The Sciatica Pain Resource Guide. I found that for my sciatica pain, I employed 5 strategies that as a whole contributed to my pain-free lifestyle for over 6 years. What worked for me might be quite different for you depending on your health, physical condition, and stress levels. I employed a method whereby I added a single strategy, and after a few weeks, if it reduced my pain level, I added an additional strategy, till I found the right combination of strategies for my situation. Want to find out more about the system that worked for me? Go to www.thesciaticapainresource.com and click on Click Here for more information under the image of the Sciatica Pain Resource Guide on the right sidebar. Be sure to sign up for the free email course with information critical to solving your sciatica pain situation. The mini course is free, so do it now.